Welcome everybody to the 8th International Indigenous Pre-Conference on HIV/AIDS. This morning we're going to start with the second session that was scheduled to be starting in the second time, but we're waiting for our first speaker. So the title of this, the Encounter Study, Exploring Factors of HIV and HCV Prevalence in Montreal Indigenous Communities. The description: vulnerable Indigenous people living in Montreal are at higher risk of acquiring HIV-1 or Hepatitis C infection than the general Canadian population. A significant number of Indigenous people in Montreal are unaware of their HIV-1 or HCV status. The overall objective of the Encounter study was to provide a preliminary portrait of HIV-1 and HCV prevalence and risk factors in vulnerable Indigenous individuals in Montreal, with the goal of fostering discussion within these communities and with public health authorities to define and initiate actions of care and prevention if necessary. For years, people have said that there is no issue with HIV in Montreal's Indigenous community. We now have the numbers to say with certainty that HIV has been in fact affected and continues to affect our people. No other exploratory research like Encounter has been done in our city, and with Montreal's rapidly growing Indigenous community and complicated political environment, this pilot research was an ideal stepping stone for creating dialogue on how to move forward with future projects in a city that does not have a single Indigenous specific HIV service point. Join us in this interactive discussion as we discuss ways to move these findings into action. Thank you.
Thank you, Joe. Bonjour, I am Kwe. Welcome and thank you for attending our presentation. The Encounter study is an Indigenous research on HIV and HCV prevalence among First Nations, Métis, and Inuit living in precarity downtown Montreal in the province of Quebec. My name is Sylvain Baudry, and I will be the speaker for this presentation. As you probably notice, English is not my first language, so I hope that you will excuse my mistakes and weird pronunciation. Before going further, let me introduce to Sedalia Fazio, our elder, who is a wonderful human being coming from Mohawk Nation of Kotawe, Quebec. Sedalia started many years ago a project on a sweat lodge focusing on traditional healing methods of her culture. Her passion and dedication led to the establishment of a permanent home for a community project with the Botanical Garden of Montreal. Sedalia strongly believes that her role is to promote people helping people. Now I respectfully invite Sedalia to do the opening prayer and territories acknowledgement.
Where what one word out is to where go on what you just wax careo get on walk and do a thirty. What one word out is to a where go to where you are in a garden no word a go or a lawyer. Neoni to go is either west nene uroni rowdy hunzake. So I say hello and I welcome you all. My name is Gawanodas, I'm Bear Clan and I'm from Kahnawake. We also acknowledge that we are speaking on the land of the Ohlone people. We welcome you to Turtle Island, which is the homelands of all the Indigenous people of the Americas. So with this, at all our gatherings in our culture, we always believe in giving thanks to Sugwayat Dizu, our creator, and giving thanks to all of creation, because without them, we as human beings will not exist on Mother Earth. So I'll do this now, but it will be in my language. I'll explain a little bit of it before doing the prayer, At the beginning, I'll say, Onagadi agahiwam that the word oruk. And this means the time has come for us to bring our minds together so our minds become one. And as I acknowledge each and every one of the beings in creation, I'll say, and that means so be it in our minds. And at the end, I'll say, Onagadi tuniore wakadari watweni tokatenza keata nikuha. And that means this is as far as I can go in my prayer. If there is anything I have forgotten in creation, I leave it to you to fix in your minds. So as we bring our minds together, let us begin this prayer to creation. Onagadi nenua detsito one horado nesquaya tisut in a hotorokeru tia hansate. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne you can't nista hamhetza. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne umpue suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne kahne karunyu. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne gozu sumadana no wara suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne hunde suma otera sumadana no qua suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne uziza suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne uzinua suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne yujun hekwa. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne ugule sumadano ziza suma. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne kayerina te kudisina ke. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne uzita ogua. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne kayerini kawarake. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne yukiso togura di weras. Tagadina yoftin guanigura. Onagadi nenua dietinu horado zio zisto parunyuts karunyate. Tagadina yoftin guanigura. Onagadi nenua dietinu horado ne yukiso tasu tone kagaraku. Tagadina yoftin guanigura. Onagadi nenua detito one horado ne squati ajoke ne kagaraku. Tagadina yoftin guanigura. Onagadi tonagadi etidoa de niguhayera zinagadi nesugaya disundan there's that hidu one horado zina hodorokeru zio hansate. Onagadi toniore wakaderi watweni tokatensai zugeni guhaizekadine swani guhragususa suwagwatagu toniowanake. So with those words being said, you can carry on with your meeting. Thank you and have a good day.
Thank you.
Thank you, Sedalia. Now,
We're having audio problems.
Je vais prendre le relais, Sylvain. I'll take it because we have difficulty with the sound. You were presenting the researchers and the people that were involved in the research. Would you try your microphone again, Sylvain?
Yes, I may try, but is it okay?
That's better, yes.
Then switch value mute. Yes, that's better. Okay, I'll continue.
Maybe put the microphone closer to your mouth.
I think it has to do with his internet connection.
Oh yeah,
Perhaps someone else can do the presentation.
So-
His internet is not strong enough.
So
I'll do presentation, Sylvain. You're in and out
go
on your
ahead.
talking. So the Étude en rencontre encounter study has been developed in Montreal, but with several people. It's an indigenous research with the constraint to speak with the public health and conditions like that. This is why you can see that I'll share my I want to share my things. Yes, here. Okay. So oops. Doesn't work the way I want. Here. Okay, so you should see my slides now. Am I confirmed?
No, we can't see them yet.
Okay, sorry. I did not. You should be, no, doesn't work.
Nope, not yet.
Okay, you should be there. Are we? No, okay,
No.
no.
Can another team member share screen and flip the slides for you? We've done that before.
Attendez, one. Do.
Janessa, are you able to flip the slides for Gilbert?
She doesn't have the most recent version.
No. Okay, we got
Sylvain,
it.
can you put them up? Oh, there you go.
There it goes.
I guess you got it now. Okay. Okay, so it's the content encounter study has been developed in Montreal with the interest of knowing about HIV and HCV, the hepatitis C concerns that we could have in the city. It was a very small research. It was done with the support, the important support of Indigenous people for the culture, for the knowledge, and for knowing the people. You can see Sylvain Baudry, Harvey Michel, Carrie Martin being part of these the people that were involved in the study. So we would like to welcome and to thank a lot of the Indigenous people who were involved in the study. There are 200 people that are really not often listened to, and we would like to welcome and to acknowledge their involvement in this research. So many are in precarious conditions. This is why the people that we were focusing on, they can have couch surfing, they can be homeless, they can be in and out of different conditions, and so we'll see that they might be seen in the city, but we may never hear and listen about them, and that's an occasion to do it now. So Harvey, can you start? Harvey would be the speaker for this slide. I don't hear anyone speaking. Is RV able to speak, or am I?
Looks like he dropped off completely.
Yeah. I'll take over for this slide.
Okay.
So Montreal is a kind of new city for Indigenous people living in it, meaning that 9 over 10 of the Indigenous people living in Montreal actually are first generation. They are the people who came in without family, without network before, and that's important in the proportion of these people. You can see in the slide that Montreal has a few Inuit among the First Nations people living in Montreal. Despite that, it makes this city being the second city in the world to have a Canadian or Northern Inuit living in it. We compare to Ottawa, which is the first, and then Montreal. And in the sample we had a lot of people that are Indigenous. We'll speak about that later. It has really a disproportion between the precarious people living are Inuit compared to the number of people that are First Nation in the city. So, RV, are you back?
Can you hear me?
Yes, go.
Okay, so that's the first slide. So are we still on that slide then? And elaborating on the, the
yes.
breakdown?
If you have something to add, go.
Well, there's nothing to add, just what we have in comparison with the larger Canadian cities. Montreal is one of the, has the proportionate with other communities.
Go for next slide, number 6.
The urban and homeless population. So the 10% of the people have experienced homelessness at any given time, and 40% are Inuit. And those interviewed do not travel too far from their home community, and those that are First Nations. But it's also, I think, it's important to note that 10% have experienced homelessness. It's a general, I guess, observation, because it's just how do we determine what homelessness is. I think in Quebec here, if any person had not spent 3 days in a stable home, then you'll classify homeless. I think that number should be higher, but I guess it's just for definition of what homelessness is. So to the next slide. Are we getting?
Go.
Oh, okay. I got to find my. I have a. The next slide. So the next slide that you're showing are the. I have it on my. I have it on my iPad here. I'm just trying to find the exact one that you are.
It's about encounter study. This is number 7.
Yeah, I don't have it. But it's
we spoke about having under 200 people participating in the study, half and half being men and women.
Oh, I don't have that on my.
And among them, we have 6% that identify as two-spirited people, mostly men. They are if we look at the people participating in the study, they are older than other Indigenous people living in this city, and they have lower levels of education, and are also and they are in isolation compared to others because they don't have much network. So in the other it's the order of magnitude of the statistics that count here. We could claim to have thousands of people participating in the study, but they are not living in the city. 200 is already a very high rate of sampling, if I can compare that to a sample. So that means count of the magnitude of the statistics and not the exact numbers. So thank you, RV. So the people that we speak of, we will have a few details about who they are so that you have a good idea of the background. They have a fairly high consumption rate of different case, but different combination of drugs, mostly around weekly or daily consumption. What is worrying for us is that there is an opioid and overdose crisis that is going on in the city, as well as in many Western cities, and this affects as much as others the people that are in the study. So that means we had several deaths over the last months that were not counted in our study. We did not investigate that for the overdose, but we know that it's present, and this is something that we worry about. The people that we speak with, that we spoke with, and that we encountered for this study, many of them had passed in prison and jail. Many had a homeless story, meaning that it can be in and out. It can be at some point in their life. And many were victims of sexual violence over their life. We can say that as adults now, it's 2/3 that are women and 1/3 that are men. But many of these people were already, 2/3 of them were already victim of a teenage childhood abuse, sexual abuse when they were teen or in the childhood or teenage, and that was 50% of boys and 50% of girls. When I look at this slide, I feel that when we want people to trust in the systems and we trust in the others that are around them in their community or out of their community, they may have difficulties to trust people without a kind of a sustained and a very present attention. If we look at the prison past of these people, it looks like not many people were helped after they got in jail. So, RV, could you go back on the slide of chlamydia and gonorrhea?
Okay, that I'm just gonna look for it again. I mean, I had them. The rate of chlamydia and go. Oh, I apologize. I don't have that one on my iPad.
Okay.
But no, I don't have one.
So there is a fairly important presence of chlamydia and gonorrhea in this subpopulation, and many are co-infected, meaning they have both the disease at the same time, and that's a worry because it's not normal to have both at the same time for most of the population that is infected. So we are worrying about that, and we have something like 6% of HIV positive people in this group. That means that they are, this rate is similar to the indigenous homeless people in Toronto, and similar to the Montreal homeless people in general, with counting and including everyone that is homeless. So for many of them, these are not recent infections. This is not the most worrying developing infection that we're looking for, that we are observing. Their numbers is large and serious, but most have treatments and are being followed for what they do as being HIV positive. Harvey, would you speak of hepatitis C?
Yeah, there are, okay, the 20 out of the 200 then that were from our sample, 21% were infected with viral infection of Hep C. And in terms of the evolution of the chronic infection, 48% were in a state, medically, I guess you would say they were in a chronic state because there was some progression in the infection rate of the participants, which is 48% that were in a chronic hepatitis C stage. And out of those groups, 64% responded that did use drugs, the IDU, intravenous drug use. And out of that group as well, 36 didn't inject. So it gives a little area of what was the mode of transmission of Hep C. Hep C was primarily was through injection, but we did find 36% did not contract Hep C because they did not inject. Were not drug intravenous users. I guess we'll get into.
Yeah. So the worry is about treating these people and helping these people because they look for food and they look for surviving before they can look for having a treatment that is costly and that is not included that is not free for everyone. So the mobility of these people, we can worry about that because in other studies it has been reported that many would travel and would infect their community and things like that. Well, we are not so much worrying about that because in the precarious condition, the condition they are, yes, 1/3 of them reported traveling in last year. 3/4 of the travels were to visit friends and family, and did not report having special sex or kind of a risky sex while they did that, and it explains also by the regular sexual encounters they have. But you can see that unprotected sexual activities were for 1/5 of these travelers. Drug use was sometimes, and none of these risky factors for infection were none of them. It was for 70% of them. So it was really not current things. And we ask also if they could, if they would be interested in moving back home or to move back their home to their community, and 69% never tried to do that. So it's something that is important for understanding that most of them that are in precarious conditions somehow considered being installed in Montreal. They are not there for a few days. So sexual activity, we can see that many people use these casual partners as partners, and they are sexually active, mostly heterosexual, and they have exchanged sex with some benefits for many of them, mostly for women. So this is the sexual exchange is mostly what we count for women. I will switch. Yeah. So sexual behaviors according to types of partners can be interested. If we look at the number of partners, we can see that in the exchange sex, there is more than 5 partners for 43%. That means 4 over 10 of the people, and mostly, and I would say a good deal of that can be also with non-protected conditions. That doesn't mean that they chose to don't protect, but probably the what we understand is also that they cannot change, they cannot choose if they are protected or not in this conditions for sex. That could be a survival sex. So most of the people would have non-protected sex with their regular partner, which is with a low number of partners, and that is really regular for them. So that's the aspect that is also considering that they are under treatment for HIV. That is not very worrying for us. But hepatitis C with unprotected sex can be transmitted. So the last sexual contact for the people was 75%. This is I would say what we HIV researcher are worrying about, but it has to do also with because they trusted the people, because they maybe have been too intoxicated, but mostly people were trusting their partner, and they knew who it was. And if we remember that they were casual, mostly regular partners, that's not a big deal for that, as long as everyone is knowing and are they have a controlled viral charge. So and they did not feel like that. Well, I would say they are normal people. So the low perception of risk is important for these people. For men can feel that they are much more at risk, and they would express it, but when they express it, this is men would do that, but most of the people feel not at risk of HIV or hepatitis C, and among them we have half that are female. So it might be very much worrying for the hepatitis C, because it's with the drug use and the conditions they are in, they might not have they may not have the means of others to with a richer with much more money to prevent and to care for that. I will let Carrie speak now.
Hi, sorry, just had unmute. So the key messages that we're getting from this is that the results are reflecting only a subgroup of our population. So we really only looked at people who are living in precarious situations in unstable housing or living in homelessness. And so this doesn't reflect the broader Indigenous community in Montreal. Within this subgroup, behaviors that are increasing the risk of HCV and HIV are occurring frequently, which will or could explain the high prevalence that we're seeing in this subgroup. So preventing or treating HIV or Hep C is not always a high priority for people who are living in the streets. When questioned or when discussing with the participants, the focus was really on making sure that they have housing or shelter, adequate food, that they're safe. And so priority is not always on health. And that's not because they don't want to take care of their health. That's because just surviving is taking priority. So 90% of the people in this study have had a previous HIV test, and only 2 out of 10 or 20% felt that they are at risk for getting HIV or Hep C. There's a strong need in Montreal for more supports for Indigenous people, and the sorry, the slide changed, but sorry, only 2/3.
Are you okay?
Yeah, they changed slides, but 2/3 have someone to count on. So when we talked about social supports, only half of participants are reporting using Indigenous culture as a support or as a resource, but we didn't ask why this was. So it's not necessarily that they don't want to use their culture, that they don't want to be connected with culture. It could be an issue of access. So that's probably something that we need to look into a little bit more. But we are seeing that only half of the participants are using culture. We also learned that Montreal, similar to Ottawa, we have a very large Inuit population, and that the Inuit people, sorry, I don't want to say Inuit people, Inuit represent a large number of people in this study. This is important to know when we're trying to tailor responses, because the Inuit culture is different from First Nation and Métis, and so we need to make sure that any resources we provide are Inuit specific as well. Indigenous people experience homelessness, do not have strong support systems in Montreal, so we're hearing that they feel detached from the rest of the Indigenous community and detached from their culture. We also know that there's a strong need for supports to ensure the health and well-being of this subpopulation of people in Montreal. The next slide. So in October of 2018, we held a symposium in Montreal to share the results of this study. We wanted to make sure that the results were given to the Indigenous community first. So we invited stakeholders, we invited people who are working with Indigenous people, we invited the Indigenous community and the participants to come and hear the results first. And what we found was that there's really a strong need for accessible and stable healthcare structures to be made available to the Indigenous community. Right now, we have the Indigenous Health Center of Jojage, which would love to support Indigenous people. Right now, there is no political support to fund this center, so we've been doing fundraising campaigns and applying for smaller grants. We currently have some health navigators, but we do not have a fully functional health center in Montreal. We know that our urban Indigenous people need this place. They need a place to share their stories. They need a place to feel connected to their culture. And most importantly, they need access to services that are free of barriers. The political response that we've been getting since 2008 from the government, from different political organizations, is that Indigenous people should just use the mainstream services. But what we know is that these services are not meeting the needs of our Indigenous community. The population is not using these services, and often when they try to use the services, they're met with many barriers, including racism, discrimination, violence. And so we know that we need Indigenous specific services in Montreal. So that brings us to the end of our slides. So I want to say thank you to everybody who took part in this study, especially the participants. And I want to open it up to questions. But first off, when we had planned this presentation, we had hoped that it would be a live presentation in San Francisco, and we had hoped to do a sharing circle. Now that it's moved to a virtual platform, we're not sure what a sharing circle could look like, but we're here to answer any general questions you may have about the presentation. But we'd also like to throw out 2 questions to you to kind of guide the discussions. The first is given this data, given the fact that we now know that HIV and HCV are issues in Montreal with the urban Indigenous population, how can we begin to put this research into action? And secondly, in the absence of any Indigenous specific HIV services or service organizations in Montreal, where do we start? So not only do we not have these service organizations, but we also don't have political support. So where do we start? Where do we go from here? And I'm going to give it over to Sedalia, who's going to guide the discussions.
And Carrie, there is a question. Excuse me, I'm sorry, Sedalia. May I interrupt? This is Joe. There's a question from Renee Mashing.
Okay.
This is the question. Did participants describe how they engaged with culture in their lives and or specific to health?
Gilbert?
No, we were over an hour of interview for that was specifically made for health conditions and context like that. We had a question about would you like to use the culture, and most of them the respondents were about women asking for that. It has to do with the low services that are available for Indigenous people and also for Inuit in Montreal that are not necessarily specific to their culture. But we did not know how we could not ask how they would engage in it, because that would have been another study. How can we help better for the culture?
Can I ask everyone who is not speaking to please mute? And that's Gilbert and Harvey as well. Please mute if you're not speaking, because there's an echo if you don't mute. Thank you.
I think Harvey released his mic again.
Oh, clicked on the wrong button. Sorry about that, folks.
Okay, so normally in a regular talking circle, we would have a protocol where only the person holding the feather would be speaking. No one would interrupt. But in this platform, I don't think we can actually do that. So maybe it would be best if people would just ask their questions or give their input through the messages, and maybe Joe, you can read what people are sending.
They can also do a request to speak, and so they could actually speak without having to type it in.
But when they request to speak, once the mic is on, there's no way we can control how many people are trying to speak at the same time. That's what's hard about this platform. We've tried it before and it just doesn't work.
Okay, we have a couple more questions. One was a follow-up from Renee. She said she appreciates the additional context, and she's very interesting to understand more about the gender-related responses. And then Pilar Montalvo has a question. His question is, what traditional human resources exist around these Indigenous populations?
Well, here in Montreal, we've got a few Indigenous elders who will get together with the homeless population, with the Two-Spirit population, with pretty much every Indigenous population that's here. We even, there's times we will even get together with the Inuit who are very open to accepting Indigenous spirituality along with their own Inuit beliefs. Gilbert or Sylvain?
Yeah. I would add that for Inuit, there is a lack of specific resources for them, as they are always considered somehow as another nation. But their history as culture and a set of people is not to be in contact with the nations of Quebec. The nations of Quebec have a common history of exchange, trade, and learning the language of the others, and they are in communication around the St. Lawrence River. The river is really the kind of articulation of their interaction, while for Inuit, there is no interaction with of this kind for them. So it's another group of people with a different culture that has no specific resource for most of the things that are concerning their living in a large city and installing themselves here in the city of Montreal.
Thank you. Now, Carrie, did you get your, did we start your thread the way you wanted it to? You had two questions that you wanted to, kind of round table.
Yeah, sorry. So we were just asking, like, given the data that we now have, how can we begin to put our research into action? So what are some ideas that people would have to put this into action to respond to this data? And also, in the absence of any Indigenous HIV services or service organizations, where do we start? So we're really blank slate in Montreal. We have nothing to even begin to address what we found in this study. So we're just looking for community feedback. Just where have people started before when there was nothing for anybody? And I feel, I mean, Montreal is so far behind in terms of addressing HIV and Hep C. So we really have nothing here for Indigenous people. So we're just asking for ideas of what do we do in that context.
Thank you. And participants may type in their questions.
Yes, or you can request to speak, and then we can, because we have control over the mic. So if people want to speak, it would be one at a time, similar to a sharing circle. If there's no questions, I guess, I mean, Sedalia, if we want to wrap up.
There is Chris who wants to enter in the conversation. Can Trevor help?
Yep, I've accepted the request to speak.
Hello.
Go ahead, Chris.
So, in HIV, reaching out to, many different populations. One of the things that that we've done in the past is really just find organizations that are doing the work in the community that's not HIV related, and start to cultivate partnerships in that way, and co-create and co-build it. And so I'm wondering. So, I mean, this is one of my first times with you, so I don't know. Is that something that you have already worked with? Are there Indigenous, you said there are people, individuals. I know that sometimes it's difficult if there aren't actual organizations. Are there any groups or organizations that exist in the community? Because we have the same problem. When someone suggested my coming to this, we were kind of all looking for seminars and webinars right now because we're looking to keep ourselves busy. And one of the thoughts was we don't have any clients. And, this is causing me to realize that the reason we don't have any clients has many obstacles, not just because we aren't in any list. So I'm suddenly wondering if there are Indigenous organizations that might.
Yeah, thank you. There are Indigenous organizations in Montreal. So we have a women's shelter and a friendship center, for example. What we're seeing when we try to engage different organizations with smaller projects is that they're overworked and understaffed and underfunded. And so it's been difficult to get organizations on board with research projects, with smaller projects, because they don't have the manpower to send someone to be a part of the project. I think the solution would be finding funding for organizations to have these positions. But then it's a question of who would do all of that and how would it be managed. And There have been HIV projects in the past in Montreal that are Indigenous specific, but none of them exist anymore. And they were successful when they were up and running. So I think it's about getting those projects off the ground again, but who is going to lead that?
Carrie, others, there are two questions and comments in the chat box. One is by Michael Parsons, a suggestion that bringing Inuit elders down from the north to inform the work and to work with the Inuit populations in Montreal. He also notes that he's stating the obvious because the resources that Inuit elders would bring. And Pilar stated that traditional resources like the Inuit elders are necessary to address these determining factors of vulnerability. So is there efforts or relationships that can be leveraged in the north to bring down any elders? And I'll mute my mic.
Renee is requesting for speaking.
Sorry, did you want to address the other question first? Sedalia, Gilbert, do one of you want to respond?
Well, here in Montreal, we do have some Inuit elders who do work with the Inuit people. But like everything else, it's the funding, it's the resources, and it's the place. We have no health center, so it's pretty hard to get together. Even like for me, especially in these last few months, I've done nothing but Zoom calls and emails and text messages, people reaching out. I've had people in my backyard. We have nowhere to go. That's our biggest problem, is we have no center where we can go.
Okay, we've got Renee who's going to speak.
Exciting opportunity to learn how to use Kudo. Is that working okay? Yeah, great, thank you. So thank you so much for your presentation, and I think the encounter study is so incredible. I'm kind of mercilessly building on your presentation because Carrie, I'm colleagues with many of our presenters, and so I just want to acknowledge that and appreciate the incredible effort I know you've put into this project as well. We're presenting on July 25th about some work that CAN is just developing, learning more about increasing the impact of our research. And so I think partly I'm offering to continue this conversation, and part of what we're really working on learning about is how to package our research findings in a way that we can present to policymakers. And unfortunately, we're still earlier in the learning curve than I'd hoped we would be at this point. But as you've noted, Sedalia, things have changed. So we're looking forward to learning how to present to politicians, to present to policymakers and decision makers. And so we're going to carry on that conversation in a presentation on Saturday, the 25th. But I hope that might be an offer to say that you have such specific data and such clarity of the picture in Montreal, and it would be a wonderful opportunity for us to partner and work together and think about how do we take this very clear information and really package it in a way that we can motivate response. Because to your point, there's a need. It's clearly documented. You've been working on the health center for a very long time. I'm probably speaking very quickly for the interpreters. I apologize. But I think it's exciting to think about how do we mobilize. So I guess my contribution is to say that we're really working on learning that within CAN and with an industry partner who is very successful in promoting messaging and building up social media. So our solutions are to begin to investigate, how to package, how to promote, how to present, and what platforms might be most effective. So it's not precisely helpful today, but I hope it's helpful in terms of potentially being able to advance our work. Thank you so much for the opportunity to speak.
Thank you for that, Renee.
Renee, I'm very pleased to hear that. We know that I guess the novelty of having so many Indigenous people and Inuit living in Montreal is important in this factor. It's a kind of new thing. They are first generation. They are not installed. They don't have a connection with their original remote communities, and that's important into that. And most of the Inuit resource that were developed so far are for the North people. They administrate from Montreal the school boards and the schools and the health, but we forgot that many of them installed themselves in Montreal, and it's a new kind of a clarity in the mind that is bringing with this research to focus that, and it did not consider the many Inuit individuals, the Inuk, that are in the city installed by themselves and that are successful, but that may need also a kind of a factor saying you count for us and you count in here. So that's important for this aspect. The only resource that we have mostly is the friendship center, which is focusing on First Nations and Métis needs, but where there is a significant resource for Inuit. I'm sorry when I use Inuit people; it's a trick of my second language.
We have a comment from Pilar. In Peru, we are thinking of actions to protect them. We have the same indicators of sexual violence against girls, and the elderly are raising their voices to end this. Perhaps this is something would be in support of this project in Canada, Montreal.
Yeah, the sexual violence is over what we would like to see, but it's not only in Montreal that it happens, and that's a concern for a lot of First Nations, Métis, and Inuit, and all over in and out of their community. They are it's a real important concern, and there is a lot. Even it's a factor that is affecting mostly women. Many boys were also concerned by that, and that's a different. Maybe they need a different approach because they may have a different reaction to that. They may go their own way instead of trying to reconnect with the community, and that might be because they don't trust the people that they used to live with. In itself, for us, it would need a lot of exploration, because we had only one question. We did not want to invite to get into intrusion of their life for the sexual violence, because it could have be another chapter of their life to speak about. So we had only one question just to assess where we were in this problem. We have a problem, but it might not be the only problem of the people that are Indigenous and living in the city.
Here's another question from Trevor. How did the hepatitis C cure change things? Is the word out to Indigenous communities about the hepatitis C cure, and are they accessing those resources?
When I'll start to respond to that. When I was working frontline at the women's shelter, so that I'm going back 2 years, but they knew, Indigenous people know about the cure. Accessing it was a bit difficult because if they were actively using drugs or alcohol, they were often told that they couldn't start the treatment. And so a lot of people just didn't access it. Others tried to start the treatment and then didn't have any kind of stable housing to stay in, and then didn't do follow-up with appointments and didn't complete treatment. I'm not sure exactly what's happening in the context right now, but there is a research project around the elimination of Hep C that's going to be starting in Montreal soon with Dr. Marina Klein. And hopefully we're going to be working closely with frontline organizations, and hopefully this will help bring up the numbers of people who are accessing treatment. But there were not a lot of people accessing it, despite the fact that they knew it was there.
And there's a follow-up question. Oh, go ahead. I didn't mean to cut anybody off.
Yeah, well, I want to add that for the study that we were able to do with the money we had, we could not do a hepatitis C test for everyone. We needed to have their Medicard for having the test, and that means that 2/3 of the people could access the hepatitis C test. And that's another barrier. If you need your Medicard to have treatments or to have tests about hepatitis C, that might be a worry. And we know that some people that were participating in the study did have someone controlling their card and controlling also their access to health and to health services. So that's important, that they are not always choosing to don't have treatment or to test about that. They are surviving first.
And again, when I was in the context of working at the women's shelter, I was ensuring access to testing for pretty much everybody. So testing was high. The issues came when people wanted to access treatment. So again, if they didn't have RAMQ, which is our Medicare, they couldn't access treatment. And often what we were seeing was that people were missing their appointments to even start the process to get the Hep C treatment. So they would line up appointments and then we couldn't get them to go to the appointments. And then we would be told that they were taking space and that they would have to find a new doctor or a new clinic to go to because they'd missed too many appointments. So they were kind of just cut off from the opportunity to access the treatment in some cases.
Thank you. This is for whoever would like to take it. This is a question about stigma. And can you discuss stigma a little bit? Some of the unique dynamics, especially, is the stigma around Hep C similar or the same as for HIV in Montreal, or are you seeing differences? Whoever would like to take that question. Thank you.
I actually wish Sylvain was still on the call because I think he was involved in the stigma project in Montreal and would be able to better respond. I'm not sure, actually.
I hope Sylvain would request to speak because he is online, he's listening.
Yeah, I've accepted the request.
Go ahead, Sedalia. Or...
I'm not seeing him joining. It may be his signal again.
Let's come back to that question because that's a pretty good question. If anyone would like to speak and ask a question and verbally, just hit your request speak button, request to speak.
My guess is Sylvain will be back in a few seconds. He has difficulties to connect. there is stigmatization about hepatitis C, and consulting also. If you go to the doctor, is because you're sick, and that's not good. The reputation, if you need to have a relationship with people and to don't make them worrying about your health or their health because they know you, and people might not be aware so much of what is going on about that. And because for many years the treatment for hepatitis C was very much complicated. It was very difficult, requesting a lot of involvement and engagement of the participants into resolving their health issues. That was part of the kind of discouragement that people had about doing that, plus the stigma that comes with that. You go every week to the doctor, you must be very sick, as a reputation. And so it's not something that is easy to handle. And there are a few clinics that don't request that accept a kind of tolerance for people consuming at the same place or at the same time as they are treating for the hepatitis C, but also they are speaking directly in dialogue with the people that are their participants for health improvement, and they make them responsible for their engagement into solving their issue of health, and they are serious about that. It's not like any treatment. It's not like taking a pill. And so some stigmatization can be felt about that, and they have to. One thing is to learn to don't use the alcohol while you do it, and that's might be what is not exactly under pressure, under presence. Harvey has something to say, I guess.
Yes, I am. Can you hear me? Yes. So as a patient advocate, I'm at the Montreal, the largest English hospital. It's called the McGill University Health Center. I'm also a patient of the chronic viral infection service, where we have healthcare professionals dealing with Hep C as well as HIV. The problem we have is that access, and even though Hep C and HIV in the general population is very, I don't say stigmatized and stuff like that, but this is a specific group. But within that group, there's group dynamics where, as just Gilbert has just mentioned, just that ostracization of a member of that particular cohort for them to leave that group to the MUHC. I have the privilege to serve on the on the Montreal Indigenous Health Advisory Council, where we sit as a lot of Indigenous service providers, but I also have the privilege to sit at the table, which is a larger table with the regional health board. The health board created this as response from the Vienna Commission for them to have access. So my job, my role of an advocate at the McGill University Health Center at the Glen site is going to be challenging within from now till a year. I have to submit my work plan. I have I'll be working with first this facilitator. Actually, I have a meeting tomorrow. I'm well known with the medical care providers at the McGill University Health Center. So the problem is a lot of our community members are not accessing it. So we got to remember, we the community embrace what we call OCAP, ownership, control, active position of what we found. So this is an issue, a health issue, a medical issue that needs to be to find solutions. So the work plan will be developing health corridors to the infections, chronic viral infection service. We have there a social worker, psychologist, and all this team willing to accept Inuit or First Nations or even Métis patients to come access health. But yet on the ground level, the communities are very hard to reach populations or underserviced populations. They have a lot of challenges for them to stabilize their life, the lifestyle, embracing harm reduction and all that. But yet to have them empowered to come take the next step, it's a competitive access to either addiction, but yet we need treatment. So when we have um, our 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 providers, they if we identify each ally at each individual indigenous point of service, then we could, that's from the building, we got to build the health corridors. I'm actually, as I said, meeting again via the Zoom tomorrow, because that I need to, we'll start on September. So to bring in those from a medical point of view, the social cultural part, it's the community-based organizations that have to respond to their membership. So it's up to the bottom. We're hoping that these individuals could have a continuum of health, but yet we have many challenges in servicing this population. And I know quite well, I've been here in Montreal 40 years, and we know that chronic viral infection, um, it's getting worse. It hasn't been, it's not decreasing. It continues to perpetuate within those communities. So I think um, what I'd like to finish, I guess, my comment. What are the similarities in this particular findings of the encounter studies, or even the differences compared to other ecosystems around the world? Because this is a unique position that we are. Yes, we don't have the political willingness to invest in health promotion, the treatment. We also have problems with jurisdictional barriers, as I also serve as the president of the Indigenous Health Center of Geojagi, where it's health. It seems to be like a political decision. Anyway, thank you for hearing me.
Yes, Sylvain is saying that stigma in both HIV and HCV are pretty high in the Montreal indigenous communities or around the indigenous communities of Montreal. And that's important into that. He tried to reconnect and to speak, but he doesn't have easy access.
Yes, we've got one last question, and it has to do with U equals U and PrEP, and what are the barriers to getting the word out? And we don't have much more time, but if you can talk about that for Indigenous populations in Montreal.
My guess is that we are not there. We are having we count in the number of people that were interviewed. There is something like 10 people that were concerned with HIV as positive people, and among them there was only one new case for HIV. Others were under treatment and they were kind of controlled for that. So you equal you is not a kind of a public speech that may feel concerned, that they feel concerned with for now. It's not a struggle. Well, there are some struggles with HIV, but I mean it's not a public struggle for what is going on in there. My opinion.
Any other wrap-up comments real quick? Okay, thank you. That was very dynamic with many elements of several barriers. Hopefully this session brought together some resources that will be helpful for moving forward. So the next session is entitled Kotawe, Start a Fire, Igniting Cultural Responsiveness Through Community-Determined Intervention Research. Gaining a healthier understanding of Indigenous women from Saskatchewan has led to integrating wisdom from a variety of recently, the last 10 years, completed research projects focused on various aspects of HIV risk and prevention. This research is about intersectionality in Indigenous women's lives and how communities and systems can better work together with women and one another to deliver better, sustainable, and affordable integrated care. Our speakers here are Miranda from Morning Star Lodge, which is a community-based health research lab, and Leona from All Nations Hope Network in Regina, Saskatchewan. Okay, Miranda, would you like to take over?
Hi, can you guys all hear me?
Yes.
Sure can.
Hi, good morning. My name is Miranda Kiwathan, and I am with Morning Star Lodge, but we also have partnership with All Nations Hope Network, which is an Indigenous agency located here in Regina, Saskatchewan, Canada. So I'm just going to pull up my screen here, if you could bear with me for a minute.
Leona is trying to get on. Leona, please click on your mic and your camera.
So she has a Windows computer and she's trying to allow the mic and the camera to access it, and it's not allowing her. So she's having a little bit of technical difficulty as well. Hopefully she can resolve that in a few minutes here.
Can you hear me now, Trevor?
Yes,
Oh,
and we
there
can
she is.
see you too.
Good morning, everyone. My name is Leona Cusant, and I'm the Kotawe coordinator for All Nations Hope AIDS Network. Okay, there we go. For Kotawe, which is igniting cultural responsiveness through community-determined intervention research.
Yeah.
Miranda, we see a whole bunch of screens on there.
Yeah, I'm just going to.
All right.
You just go full screen.
Okay. Can you guys see it now?
Beautiful, yeah.
Thank you. All Nations Hope would like to begin by acknowledging that we are in the traditional lands of Treaty 4 territory, the original lands of the Cree people, Ojibwe people, Saulteaux people, Dakota, Nakota, Lakota people, and the homeland of the Métis Nation. We respect and honor the treaties that were made on all territories, and we acknowledge the harms and mistakes of the past, and we're committed to moving forward in partnerships with our non-Indigenous relatives in the spirit of reconciliation and collaboration. So our next slide just shows you a little bit about Treaty 4, our Treaty 4 Governance Center, and that we have 28 First Nations communities in Treaty 4. We'd like to acknowledge the people on our grant. So Margaret Kiska Piesis, who's a knowledge keeper with All Nations Hope. Mrs. Charlotte Lopi, principal applicant. I believe she's a doctor. Shohan Isley, co-applicant of Manitoba Harbour Action Network. Dr. Alexander King, the co-applicant from the University of Saskatchewan. Sherry Cochran, a collaborator from All Nations Hope. And Jan Tickner, at the time was a collaborator for All Nations Hope and also the creator of our proposal. These are all our partners, where they come from, our logos. So to talk a little bit about All Nations Hope. So All Nations Hope has been providing education and service and support to the communities and families in schools, organizations, and on First Nations communities since 1995. We provide HIV, AIDS, and hepatitis C education, prevention, and support in the community. We facilitate different workshops in the area, and we meet people where they're at. The staff are involved in communities, task force, where we're connected locally, nationally, provincially. We've made a lot of gatherings, conferences, community-based research. We're involved in many different things in the community, including bringing ceremony to people that can't make it out to the land to have ceremony there. It's important that we work together to address the epidemics that we're facing and that are affecting the Indigenous people in Saskatchewan that affect all of us as a whole.
Let me introduce Morningstar Lodge. Is an Indigenous community-based health research lab. Our mission is to build capacity by training, teaching, and hiring locally. Our intentions is to promote Indigenous research methodologies by practicing community-based participatory research. Our vision is to promote supportive environments by creating healthy and reciprocal relationships with Indigenous communities. All of our research projects are co-collaborative. In the lab, we work as a team on a variety of different projects. Morningstar Lodge leads in a good way. We provide tobacco ties are gifted to our participants in exchange for sharing their stories and knowledge and experience with us. Our opening and closing prayers, often done by our meetings, both in the lab and in community. Morningstar Lodge staff and community participates in ceremony held by our elder and our community. Indigenous language is shared and used in the Morningstar projects. Guided by OCAP principles, First Nations Government Center introduced OCAP in 2002. And we all know what OCAP stands for, but just a reminder that just out of respect that it's ownership, control, access, position of First Nations controlled data. And MSL staff are trained through OCAP, nothing about us without us. Yeah, it's your turn, Leona.
Okay, sharing Kotawe's journey. Sorry, Miranda.
That's all right.
The goal of Kotawe. So Kotawe's vision was to restore people, restore the cultural teachings into Indigenous women, bring it back, to ignite a fire in their souls, and that they could bring this back to their home fires. So take it back to their children, to their grandchildren, and keep it going from there. So the purpose of the study was to develop and implement and assess the impact of land and gender-based cultural interventions. So we've taken the women onto the land. It was led by ceremony to begin with. It started with ceremony with an elder. Everything that we do starts with ceremony. It's led by our ancestors and our knowledge keepers, our old ones. Everything that we do starts with prayer and ends with prayer. And I think we're doing a really good job so far. Our women are doing really well. Can we go to the next slide, Miranda?
Yep.
So our participants, they've been named the Willow Warriors, and that was given to them. The Willow Warriors was given their name by our elder, our old one. We call her a Kotawe, Elder Betty McKenna. She talks about the willows being strong. Our willow warriors were hand chosen, they were selected, and I think they were given to us by our ancestors. Willows don't break, they bend. And the willow warriors have been taught all about how willows grow, how within their roots underneath they communicate with other plants all around them, meaning that our women will communicate with other women in the community and bring them in for the teachings. Our women have been through a lot in the past year, but they're amazing women and they're very resilient. Continue on.
Okay.
Oh, there we go.
Yeah.
Go ahead,
So
Marla.
this is our willow warriors and our no kukumberi, and this was taken after I think it was a 4-day workshop learning about the drum and how it was gifted to the Indigenous people. So one of the things that I like to talk about when introducing Kotawe, it was the importance of relationships. Here are some pictures of the willow warriors throughout the year and the teachings that they've taken in and the ceremony as well. Focusing on the bottom left corner is a picture of the tools that we were given, or the willow warriors were given throughout their journey with Kotawe. And one of the things that I find very unique about this picture is that each of those items on that sacred cloth, the women had built a relationship and had built companionship and have also disciplined themselves to the sacredness and the beliefs around these items. And for example, if one had kind of went off on a weekend or whatever, or was not feeling in her right set, they wouldn't handle those sacred objects. So each object there, you could see a ribbon skirt. So one of the first workshops that the women had worked with was creating the skirts for themselves and the importance and what the skirt really meant in Indigenous perspective. Again, you see some cedar, sweetgrass, sage, and the red willow. The red willow is a really significant being that we work with as the red willows learn to understand more about what the red willow is and how it they come together and are united as one. Another item there is a drum. That was a very successful and a very heartwarming workshop, as we were able to see that relationship building with the red willows, or with the willow warriors. I don't know if you guys could see, but there's a jar here, and it's blue. That was also an experience that the willow warriors had participated in making bear grease. So again, when we look at your right corner of the screen, you see the women in community representing All Nations Hope Network and community their second sunrise ceremony, and it's a life changing for them, as they would say. So the research journey with the Willow Warriors and the Kotawe team is what I'm going to share with you guys today. I want to share with you how the collecting of the data is also a story in its own when working with the Willow Warriors. So how is the data collected? The data is collected through cultural intervention practices, and these cultural intervention practices are the slide that I showed previous to this one is what the women do when we go out into the land and participate in ceremony. We also do with the auditory recordings, photo, and evaluation tool that's handed out after each cultural intervention practice. The research methodology used for this project we do the transcribing of the data using the technology and our staff, and there's no third-party usage in this process. The participants remain anonymous during transcriptions, and the data is transcribed and stored and locked and secured in spaces, including encrypted servers, to ensure that confidentiality and the appropriate data is stored properly. The data analysis is the quantitative data. We've also used SPSS, statistic analysis software, in the lab. For the qualitative data, we used Neneteweon Achiwe Keke Meski Kupa Eke Jesque Acheme Ikuena NACPA. As an Indigenous woman, I think it's important to practice my language, and so I'm still learning. And so from now on, I'll refer to that methodology as NACPA. NACPA was formerly known as the Collective Consensual Data Analytic Procedure, which is also known as CDAP. One of the things I'll be sharing while moving on more into my PowerPoint is how we took this methodology into ceremony and how our Kotawe had renamed it after she had lifted pipe for us. Another process that we used was also NVivo. NVivo is a software that's input into it's an input that transcribes the data to collectively sort and categorize the data while we were analyzing it. So again, when I was talking about NACPA, this is a research methodology that we're happy and excited to use and share with community. Morningstar Lodge staff performs NACPA, and the translation from Cree to English results in medicine, healing, stories picked, sorted, and stored. NACPA is appropriate for community-based research due to its collaborative nature. It's also able to be done with several remote stakeholders. It may even be done worldwide and online. We are incredibly excited to serve our community better with the new and innovative method. A panel consisting of community members and MSL research staff was gathered to conduct the NACPA, along with PowerPoint presentations that was created after the data for the pre-analysis, and the Excel spreadsheet was also created. The spreadsheet contains one tab per question analyzed, and at the top of each tab, a column was labeled with different symbols that uses a symbol to reminder to avoid bringing any bias when sorting the data. After using the NACPA methodology, we were able to identify themes. So the NACPA session would take place every four times a year. So we would follow the seasons. As you see here, we have spring, summer, fall, and winter. Those are also when our cultural intervention practices take place as well. The research method used by Morningstar Lodge researchers and participatory data analysis inducted thematic analysis was completed with our research circle data. So after having the Willow Warriors participate in cultural intervention practices, we would perform what we call a research circle. And this research circle is guided by 4 questions. So the results from our NACPA session, I'll share here with you guys. The essential point was that the Willow Warriors brought up was the initial experience with ceremony and finding spirituality through the cultural intervention practices and bringing these teachings into their home fire and finding direction through ceremony, recognizing internal struggles, creating safe spaces was also very important to how the Willow Warriors experienced the CIPs. These participants brought positive change to self-esteem and built relationship through Kotawe, internal, cultural, sisterhood, home fire, nature, and community, as well as taking care of themselves through memory teaching and intergenerational exchange. Finding direction through ceremony, recognizing internal struggles, passing cultural identity to their children, and creating cultural safe spaces was also what the Willow Warriors had addressed throughout the season. The influence of the CIPs has built a sisterhood in Kotawe. Building of relationships, womanhood, and sisterhood is how that formed throughout the first cultural intervention practice to that would be from spring to winter. The Willow Warriors expressed moving forward and allowing feelings and emotions were a way of recognizing self-growth, healing with types of ceremony, healer guidance was also outstanding. Programming, routine, comfortability made a connection with community. Positive responses to adversity allowed self-reflection of the healing journey. The Willow Warriors recognized the importance of igniting self-courage and intergenerational responsibility of culture. The living experience shared by the women told a story of hope and transformation, which helped them heal from stigma and negativity from a loss of culture and identity. So again, I was referring to how we carried out the data process and how we collected it. So the method here is the Indigenous methodologies of storytelling and research circles were used in the qualitative approach. The CIPs, an empowering community-based research strategy, was utilized, and the Willow Warriors in the project were asked to participate in seasonal cultural teachings and are to answer 4 questions as it pertains to them personally. And these are the 4 questions that I was talking about that guide our research circle for every season. And so the first question is, how do Indigenous women experience cultural intervention practices, or also known as the CIPs? In what ways, or if any, do the CIPs influence how women experience physical wellness through fitness, strength, and stress level, aches and pains? The third question, in what ways, if any, do the CIPs influence how women experience relationship with themselves and spirit change? And the fourth question, what do women do to encourage wellness in their lives after participating in the CIPs? The project recruited 7 Willow Warriors living within the Regina area who have completed 12 months out of 36 months of the project. The Willow Warriors have participated in weekly programming, 4 CIPs that focused on teaching and knowledge by elders, healers, and working with Willow Warriors in group settings and individually for the last 12 months. As the RA, my observation for the project is that the Willow Warriors have expressed a high interest in learning and receiving cultural programming for each seasonal cultural practice. The results testify acceptance, self-love, traditional teachings, women's roles and responsibilities, sharing personal stories, beginning their healing journey, routine, created safe spaces, and involvement in community. The results of the evaluation tool have determined that the Willow Warriors made positive alterations to programming. And the Willow Warriors enjoy the guidance and direction from guiding elder and healers. Also, the Willow Warriors feel that programming is delivering expectations, but would like to start reflecting and after programming and whatnot, that they would like to learn more traditional songs and traditional hand-on practices. I'm going to share a video here, and this video is the Willow Warriors drum teaching. This was a 4-day session, and again, this was one of the most powerful sessions that I've seen growth within the Willow Warriors and just building that relationship with the drum. So just let me play it here, and yeah, enjoy.
Then I went back around here.
So just going to speak a little bit on that video. I'm not too sure if anybody could hear the sound, as I couldn't hear it on my mic. But if anybody would like to see that video, I'm sure that there's a way that Leona could share it. One of the important things that I really enjoyed about that session is that the women had come together, and like I have mentioned in the PowerPoint, is that they have created a sisterhood. And just watching them learn about the drum first, as we learned about the teachings and the story of the drum and how it was given to a woman, and the woman was to bring that drum back to her community. And so that was a very a powerful workshop, as each woman and myself and the Kotawe team really took that in, and to this day we have a different perspective when it comes to that drum, as we were given that teaching now, and the importance of the drum. And so that was one of our most powerful workshops, along with the many ceremonies that the women do participate in. And so with that being said, their drums come with them to their ceremonies that they participate with the Kotawe program. So the next slide here is what our poster presentation would look like. This poster was created from, again, with the results from our methodologies, and again with the guiding questions of the cultural intervention practices, and just kind of gives that story outline of how it was created. And so this is our poster, and so I kind of took our information and put them on the PowerPoint. And so this is all the information on this poster. I know it's kind of too small to see, but this is the same information that I just shared with the slides that came before this one.
Thank you, Miranda. I just wanted to add that our Willow Warriors have experienced a lot of different barriers since they first began their journey in Kotawe. Some of them have experienced losing family members. Some of them have experienced giving up addictions. It's all different things for different people, but it's amazing. They wanted a drum. They wanted a drum from the beginning. They started off with a visioning retreat, and they told us what they wanted to do throughout the year. And making a drum and learning how to use that drum was one of them. And the drum teachings that came from the elder, from the Gitayak Betty McKenna, was just amazing. I learned so much that day. I thought it was going to be easy making a drum. It wasn't easy. It wasn't easy at all. But the ladies do carry their drums. They bring them to every full moon ceremony. The women have been to sweat lodges, full moons. They've been to a ghost dance. They've been to numerous ceremonies. I just had to add that in. Does anybody have any questions? Or Miranda, did you have anything else you wanted to add?
I just think I just want to really express that the importance of the relationship that the women have created within the program, and within the sacred objects that we do use, and also with ceremony, and also with community. One of the biggest things that I would like to highlight is that healing journey that they bring to their home fire, and passing that on to their partners, or to their children, or to their grandchildren, is very significant, and a really good positive result from the Kotawe program, and how it is important that culture and ceremony is a need to assist those who want to heal. And so I would like to just mention that, because it is something very beautiful to witness, and I'm very honored to be a part of this journey. So yes, thank you. Yeah, so I guess with that, if anybody has any questions, please feel free to ask. I can't see I just have my PowerPoint presentation. So Leona, if you see anybody with the questions, you'll have to.
I can't see them either, Miranda.
Okay.
Trevor has a question.
Sure.
He'd like to say something.
Yeah, hello. I'm just turning on my camera now because I want to see your beautiful faces. Let's see. There we go. Listen, I know that you submitted a beautiful video for the Indigenous Peoples Networking Zone in the Global Village of AIDS 2020 virtual. The International AIDS Conference had to go virtual just like us. And this was supposed to be a pre-conference that was going to happen in Oakland and San Francisco, the International Indigenous Pre-Conference on HIV and AIDS. And you sent in a whole bunch of scholarships. You were going to have a whole bunch of the Willow Warrior women come down and interact in San Francisco. And I was really looking forward to it. But seeing this presentation just makes it come so much more alive for me. The video that you submitted made me tear up. It made me feel something from a research project. Now, how did you do that? And to me, it seems like it's not only about data, getting the data and then flying away with it, and maybe some change will happen in the world. We'll never find out, right? But this is different. You're making changes in people's lives while they're participating in the research project. And I felt that from the video. And to hear now the data and hear the kind of robust nature of the great data that you're receiving, I think that you've gone and indigenized this whole colonizer research thing. And I just wanted to congratulate you on that, and to let you know I can feel something from this project. Even though we're interacting online, I'm feeling something. So somehow we've overcome this barrier of distance and travel, and you're coming up with sharing this data and sharing this. I feel the spirit from this. And I just want to thank you for that, and ask you, like, did people become more spiritual? Did they get deeper into their traditions? Were there people that weren't really connected who are now connected? Can you just elaborate a little bit on that? I'm feeling it, so I want to hear more.
No, thank you, Trevor. All of the 7 Willow Warriors are all at different levels in their spirituality, but all of them are more connected, if not so deeper, since the beginning. Like during the COVID time when we couldn't meet together, we'd have 3 of them that would meet with social distancing during the full moon, and they'd take their drums. And that's something they've never done before. A lot of them had never been to a ghost dance ceremony that they went to. They've been to women's groups, like literally women's land-based teaching groups, like 4 days on the land. There's so much, Trevor, that we've done. It's impacted all of them emotionally, mentally, and spiritually. And then during the COVID time, when we all had to social like distance ourselves and be isolated, everybody had to look at their physical piece. So they've all taken a look at their holistic wellness and addressed it. So when I said they were met with barriers, I want to say more like lessons, or maybe it was teachings that they were meant to learn from, should be the proper way to quote it. But it's been an amazing journey for these women, and to watch them grow from when they started to where they are now. Like, we've had one lady who's went through our biggest lodge, which is a Sundance. That's 4 days of fasting and making offerings.
Mm-hmm.
And or some people call it a thirst dance. But we have 2 willow warriors that went through that this summer. So it's definitely had an impact on their spirituality and how they handle things.
Mm-hmm. Thank you, Leona. I would like to add to that as well is from the beginning of the data as the RA in the project, I can honestly say that when we've had our first sharing circle in April, the women had their walls up, so say. And then after coming to spring and then going to summer, they had already built that relationship within the group of the Willow Warriors. And from that, it went to womanhood. So come fall, it was womanhood. And they had identified who they are, their responsibility as a life giver and a caretaker. And then come winter, they were calling themselves sisters. So it went from womanhood to sisterhood. And I always like to that was one of the beautiful things that I seen was the 4 stages. And that's why I say that it's about that relationship building with not only with yourself, but once you have built and identified who you are, you're able to open up a little bit more. And as you keep opening up, you're opening up more and more. And now today we can say the Willow Warriors is a sisterhood that participate, encourage, and recruit people to come to our ceremonies and to come to programming. And it's so beautiful, Trevor. It is honestly a beautiful thing to witness, and it's amazing. And so for me to say that, yes, cultural intervention practices is very necessary to when healing and wanting to go down that, finding out who you are, where you come from, the strength of the medicines and the strength of our ancestors, to believe and understand and feel our ancestors in ceremony is even that much uplifting. And I always say in our language in Cree, we say Waneska, and that means wake up. And I believe that who we are in our language and in our teachings and in our gifts are dormant, but when we come together and we sit together and we work together, they wake up. Thank you.
Thank you, Leona. Miranda, there's a couple questions and comments, and I think you've covered a lot of it. Gilbert had a question. I think his question, I'll read it. It says, my question is about the daily life and relative security these women had. In other words, was the culture a plus in their life, or was it did it start out to be just their only link with peers? And then Pilar also had a question or comment about involving youth. I mean, have you seen an evolution of involvement with youth as a result of this intervention here with the women?
Well, the women had access to basic ceremonies like smudging at our office. But when they started with the Kotawe, on the Kotawe journey, they started doing their own ceremonies. And it has affected the youth that I see, especially the youth in their family, because we have the women bringing their kids into ceremony. One of them her little one has a drum. We started the old lady called it a red ribbon readers, where we encouraged them to bring in their kids, to bring in their nieces and nephews, to bring in their grandchildren. So it's having an impact on their whole families, like a ripple effect in their families. Yes. I hope that answered your question.
And also too, we do have the Willow Warriors, as Leona said, they bring their children to ceremony, and we have the young women. That's one of the important things too that we should mention about the ceremony and the programming that happens within the Kotawe is that our co-researchers, the Willow Warriors, are encouraged to recruit people and recruit their family if their family members want to be a part of this journey. And Leona was speaking about the red ribbon readers. And I don't know if you guys can see it, but this is the little booklet that the Willow Warriors had created in, again, another programming that they were encouraged to bring their children. And it's a storybook that shows the teachings that the Willow Warriors had went through. And they're encouraged to read this to their children. Another thing that I think is very beautiful is that the Willow Warriors bring their young daughters or their young sons who help in ceremony to this day. They help after, say, for example, after our full moon ceremony, we have a small fellowship where we share our berries and our offerings. And we have the young ladies hand out the food as escapios. And that's another Cree word known as a helper. I'm just going to go back to the screen here and see if I could see the questions. Okay. I better just go back. So unfortunately, I can't see the questions. I could just see my PowerPoint.
Okay. There's just another comment from Gilbert. Yes, very well, thanks. We don't know yet how deep socialization around culture, for example, is a strong structure in our relations and leadership. We learn a lot from women. I think a resocialization that involves culture is providing a strong, strong roots, strong structure.
Mm-hmm. As life givers, it's the one thing we have in common with Mother Nature.
Mm-hmm. And as we said, it's really beautiful to see and take back that responsibility, and it's a beautiful experience.
And maybe I'd like to put out quickly, Leona and Miranda, if you would maybe be interested in presenting this presentation sometime in the future for the Alaska Native Tribal Health Consortium here in Anchorage, Alaska.
Absolutely. It'd be an honor.
Yeah, I'd like to look into that sometime.
Absolutely.
I just wanted to say too, this is Joseph. I'm Joe Cantil, Tsimshian Nation in Alaska. Before we wrap totally up, after Leona and Miranda wrap up, we do have a closing prayer, so don't go away.
And then if you guys could see my slide here, I would like to mention and acknowledge the importance of the navigators. The navigators for the Kotawe program are very crucial. They are the frontline workers. They are the ones that work very closely to the Willow Warriors, and without them, we wouldn't be able to do the work and have the results we have today. So I would like to acknowledge Melanie Kingston and Carolyn Pelche.
I couldn't do the work without them. I just coordinate this stuff, and they work hands-on with the women daily. I couldn't do it without them. During the COVID times, so the women had ceremony with them, they did curbside visits and delivered medicine to each woman that needed it. They were absolutely crucial in this.
Very, yep. And then also to our elder, our leader, our fierce leader that takes us to ceremony, that introduces us, and that gives us that responsibility, and so patient with us. So I'm very thankful for Nokombedi being very patient with us as we're learning.
I have a question. How closely are are Western medicine practitioners to this project. Is there any chance that they're integrating or at least participating or knowledgeable that you are there and what you're doing and the benefit you're providing? And do you think it's improving access to care?
Well, we do have 2 doctors on our research team, Dr. Charlotte Lopi and Dr. Alexander King, who I'd like to give credit to. And of course, as you can tell, they're both women. We're just in the first year of doing this, but I think that our data and our results are going to show lots. And I think it'll wake other people up as well, including the doctors.
I'm going to let this silence and this safe space settle here for a moment before we invite Sedalia to provide a closing prayer.
Well, with that, I would just like to thank all you for allowing me to be a part of your time today and to share our story here from Saskatchewan. And it's been a pleasure. Thank you.
Thank you. It's been an honor.
So this is one of the reasons why I don't like this format to do Indigenous work. We end up forgetting that in our culture, the most important part when we're getting together as a group is to bring our minds together, to bring in those prayers for creation, to thank Suglayat, our creator, for what he's given us, not only to open, but also to close. Because once we open this circle, it's opened up to the universe, it's opened up to Suglayat Dizu, it's opened up to creation. And if we don't close it properly, then everything that we're working on just kind of sits in limbo because we didn't close that session. So that's what we'll do now. And hopefully soon we'll be able to actually get together face to face, everybody. And we won't have to go through this kind of COVID conference calls. Managadia gahewa sedoan hodu gigodzinu igwajata garoru dam za tidoan horado na sugwat disu zinahodoro gero dam da tidoan horado ziro dam sadade nuani wanizarade zinahodo diugwa tarunyo neoni agwego dayetino horado ne yujun hekwa dan zinahodo gayon na zinihadi. So the time has come for us to bring a close to this circle and to thank Creator for everything that He has given us, and to thank Creator for listening to us, listening to our words, listening to our prayers, and bringing all those prayers and all those words back to creation, so creation, our medicines, everything here on earth can help us once again. All our prayers and all our hopes, that they help us to realize them. And before shutting down and closing, I'd just like to wish you all health and happiness, and let us all pray that this COVID thing goes away soon so we can get together again. I love you all. I miss you all, and hope we get together soon. Ona, thank you.
Hi, thank you.